Good afternoon, ladies and gentlemen. This is Saurabh Ambekar here coming at you from Canada. I'm going to present a topic on healthcare administration and management, which is very much important and which is changing the face of the healthcare delivery system every single day and every single minute, as and when, all these different scenarios have come up like COVID and other aspects, and how, healthcare has been organized and been organizing themselves to cope up with these natural calamities that are happening. And that's what my topic is all about. And moving forward to the next slide, uh, I'm going to touch base on three different change management system that has been effectively seen, which is the disease management system, delivery of care, and healthcare coverage. And I'm going to compare these three factors with three different countries. There'll be a comparison there between US, that is United States, Canada, and New Zealand. I believe that why I chose these countries are like they have good healthcare system in place, streamlined policies and procedures, and everybody and anybody in the country are covered under their healthcare policy. And moving forward, going to the first, which is disease management, how the system works in US. And United States, I've seen, has been very generous in spending money towards population, with a small hurdle in between on how they can still cover different aspects of about the people who are not working and the underprivileged people. United States of America have actually a healthcare system for everyone who's sick and in high need, and high cost affects the nation and the people. The poor outcomes mainly impact the patients. That's what they have been experiencing since the time they have made all these different affordable care acts and stuff like that. Over the past quarter century, United States has researched and searched for ways to control the growth of healthcare costs. That has been the major concern for United States, as it is a highly populated country and people come from every walk of life. And there are population varies from veterans to baby boomers, and now they are like late adopters, and they are early adopters and stuff like that. So different stages they have been going through, and they're looking at how they can control the healthcare cost. Definitely, it's a concern for the country, but they're trying their level best to do that. Rather than relying on governmental regulation, the United States has chosen to use private marketplace as an instrument of cost cutting. What they've done is they have actually converted this into a business where private insurance companies play a huge role in covering most of the population in US. And in my further slides you will also see that how costs have been distributed according to the population numbers. And it starts from millions and how they have been segregated. I have a nice graphical no sorry a chart presentation for you guys. Disease management programs show promise in improving the care of patients with chronic illnesses, which is highest number in US right now. There are, obesity is a chronic illness which has been going on in US, which has the highest number among all the other countries. Heart diseases, heart failures, and other thing which I recently read in the news as well. Like, people are totally dependent upon outside food, which is your fast food, and that's how it's affecting their overall health as well. So moving on, commercial disease management may have been damaging over the years, unintended consequences for healthcare systems. And it's a trial and error what the country has been doing, like how they can still manage better, whether it's commercially or whether it's like through the government, and try to bring that under control. Healthcare institutions should initiate in-house disease management programs that assist primary care physicians in doing a better job, rather than outsourcing growing portions of healthcare to specialized commercial outfits. This was said by Millwood in 1998, when all these healthcare institutions were coming into role and being solidified in the country. They were trying to put so many different aspects of how primary care can also play a huge role in connecting the dots, and patients should not fall through the cracks. And the best example I can share with you in the future slides about Canada, how they have reformed the healthcare, and how primary care systems are actually working beautifully in the country. Forward, this picture says it all on how management needs attention. Like what's happening these days, people in the initial days, for a cholesterol clinic, suppose somebody is giving a demonstration about how to control your cholesterol level, you need, he says you have to take a smaller slice of the cake and not the bigger pie, so that you can control your cholesterol level. But they didn't say how long you need to take it, how often, and that small piece of education was still missing. But if you see on the right hand side of the picture, we have to take control of a larger slice of the cake when it comes to healthcare budget, right? So people are trying to cost cutting has been done on a drastic level, but education and educating people have been not in place, and people are unaware of how they can still take care of themselves, which is a bigger concern for the country. But I've seen over the years, US have developed certain systems in place, and they are trying to meet what to say make the ends meet, and go from there. But I really love this picture. That's why I wanted to share with you guys. Uh, Talking about disease management system in New Zealand, they have streamlined their processes. New Zealand went through a very rough phase in the mid 90s to 2000s about infectious diseases that came through zoo and zoonosis and all that other stuff. So what they tried to do was they approached and advocated as a means of improving effectiveness and efficiency for getting these chronic diseases under control. And they actually made a evaluation team who were working on this effectivity and the evidence synthesis. So the team was working on it, and several unique features characterize infectious disease like epidemiology in New Zealand. And historically, as I told you, well organized government run control programs have actually eliminated several zoonoses. So when they created this team, when they actually did a research on why this was happening, and they came to a few conclusions saying that due to the climate, due to the weather, because topography of New Zealand is pretty much varied. You can see from mountains to sea all together in under one country itself, and it's mostly the island. So it's affected by seawater, it's affected by so many different aspects of the environment, so that they had to do a due diligence on how to control certain diseases that was affecting the humans, and they came out positive as well. Communicable disease control has been mixed. Rates of rheumatic fever, tuberculosis, enteric infections are high, and rates of meningococcal disease were also increasing at that time. And that was the biggest concern for New Zealand government as well. These diseases are over represented in New Zealanders of Polynesian descent, who generally live in more deprived and overcrowded conditions than of those of European descent. A Polynesian descent, there were two different type of population they were living there, and one was more crowded, which were middle class, and the classes were there, and some people are staying away from it and having little bit more luxuries in life and more attentions towards health. They were affected, Polynesian nation were affected more, and they needed more attention from the government and the healthcare system. They had a challenge, which was, a key challenge for the future is to build on successful strategies and apply them to persisting and emerging infectious diseases threats in small geographically isolated country with limited economic resources. So they came up with the same idea, like primary care services, give them access to people, any people who are new to New Zealand, newly immigrated, or coming from different countries. They have access to these physicians who can do the due diligence of assessing them, and the better way to put it is prevention is better than cure, and that's how they started working on it. And the primary access was the prime attention of the healthcare system. Coming to disease management process in Canada, disease management programs have been advocated to improve long-term outcomes, especially if you see for heart failure patients. They actually came up with these disease management program where People are seeing there were more heart diseases which were more prevalent and more chronic, so they showed keen attention towards it. Understanding contact networks are important for modeling and managing the spread and control of communicable diseases in population, and that's the reason why they came up with DMP. Information on study setting and design, participants, characteristics, and interventions tested were collected. A study quality assessment was performed. Main clinical outcomes assessed were all-cause mortality and rehospitalizations, which were related to heart failure and hospitalizations and mortality. So they came up with the research saying that looking at the different numbers and how people are affected due to more stress and more living expense and stuff like that. So they were seeing that heart failures were more common and there were more hospitalization and rehospitalization that was happening, and they wanted to bring that under control. So this is we are talking about in the 60s and the 70s. If you see on the picture on the right hand side, potential relevant studies were identified. So they came up with clinical trials and all those different studies that happened, and 750 studies ineligible based on the title and the abstract. Eligible studies retrieved for detailed evaluation, and then 21 studies were excluded. Totally 33 studies included in the meta-analysis. So that's how they came up with an idea how you can exclude which are pseudo patients and which were true patients. So that was the way of doing it, and Lippincott actually mentioned very beautifully in his article there. Second most important aspect I want to discuss today is about delivery of care and a little bit about patient participation in all these three countries. Let's open the section with a question. Okay, if you're born in the US, are you likely to have a longer or a shorter lifespan than if you are born in any other industrialized country? A question to be asked. It's an interesting question, isn't it? Ever brought it up to your friends? Ask your friends, like, what do you think? You have been better lifestyle and better lifespan than in any other country while you are in US? What I read and believed is that discussing healthcare among friends can get a little sticky sometimes, right? Everyone seems to have his or her own opinion of what works and what doesn't when it comes to what approach works best in taking care of the health needs in the residents of a given country. It all depends on person to person, how they have been brought up, how what kind of diet they have, what kind of lifestyle they live, what kind of exercises they do, what kind of precautions they take, and so many different aspects that play a huge role in the delivery of care, and also it directly corresponds to the patient participation as well. The World Health Organization is an agency of the United Nations, focuses on international health, right? WHO has defined a health system, also called as a healthcare delivery system, and which has all the activities to promote, restore, and maintain health. This broad definition includes policies, regulations, laws, and both direct and indirect patient care. This is very beautifully mentioned in the WHO website, and that's what I liked, and I wanted to share that with you guys. What happened in the United States was the healthcare delivery grew from a local family doctor to a larger group practices. That's how the family healthcare delivery system started in US. It started with a small local family doctor where they used to go, and it was a barter system. Like, you take care of my health, I will pay you in crops what I grow, and the kind of different different materials they were offered. So there was no money transaction there. It was just a barter system, which was, I think, very beautiful. They should have continued it so far, but I think material world takes over really fast. And often a family member could be taught to follow the doctor's orders, and no outside help was needed. So it was very easy at that time, and lifestyle were different too. There was no fast food at that time. There was nothing called as ready-made food and canned food and stuff like that. So people, you never used to get sick that often. So whatever doctor used to give them a suggestion, and the family member used to follow the orders and take care of the family member who is sick. But now the case scenario is totally different. Like, we have to take care of each other, and maybe the brother has some different disease, sister has a different disease, and we have to go back and forth on with the doctor and get that resoluted. Approach to paying for healthcare changed when Medicare, Medicaid, and employer aid health insurance arrived on the scene. However, that still left about 15% of Americans who were uncovered and could not afford private health insurances. The Affordable Care Act, also known as the ACA, was a step in trying to close that gap, and to some degree it did. This is where I wanted to stress on the point was, these acts were made to kind of around 15% of the population. That is a huge number, which was not covered by the health insurance with the, delivery system. They were deprived of the services, and it's still a problem in US, and they're still trying to fill that gap to some extent. While in New Zealand, if how the healthcare system was, as I told you, primary care, physicians were in place. Only if it's an emergency, you could arrange to see a GP, which is a general practitioner. And general practitioner is a fully trained medical doctor who can give you medical advice and refer you to further tests as special treatment if needed. And another thing I wanted to mention about US was, there are specialists in place, and the healthcare system has a lot of doctors and a lot of resources which are still, unexplored compared to all these other countries. And, I really believe that US and United States can do a much, much better job than they're doing currently right now. Treatment may either in the public healthcare system, which is subsidized or free, or through a private provider, which where no people pay. So both the systems are available in New Zealand. I think it's the same in the United States as well, and I believe that. I've friends who are personally whom I know who have been living in the United States, and they say that there are some policies which employers cover for their delivery system, and there are some which they have to pay out of the pocket as well. So New Zealand has around 40 public hospitals spread across the country, which is the delivery system is so streamlined, and larger towns. They provide care for emergencies, serious health problems, accidents, and illnesses. Their services include emergency departments and medical, surgical, and maternity services, which is fantastic. What else a population wants when they're living in a country where all these services are offered in the country? And not that I'm saying that US doesn't have that. United States still have it, but the question is how many are using it and how many can afford to use it. In Canada, where I belong from, I've seen healthcare is really a system where they have been evolving and still evolving over the past few years, and coming with better ideas and better health delivery system. It's just it mostly these healthcare delivery system are operated through the provincial bodies and territorial systems, which are funded publicly or and by the government as well. And there is a federal healthcare system as well, which governs the major laws and policies in place. Canadian healthcare believes in universal delivery of care, which was commenced in 1960s. That's what I was talking about. Universal care started in 60s, and now it's been progressing. Today is 2020, and we can still see. I immigrated myself in year 2012, and I have been well taken care of. My family doctor, and if there is anything which is required, they follow up diligently. So there are less chances of people falling through the cracks. Not that it's flawless. Everything has a learning curve. Everything has a developmental curve as well. So it's still developing on a better side. Primary care systems are in place, as I told you, and or effective delivery system of care for those who are looking for GP or new into the country. This helps to reduce outpatient load in hospitals and ERs. What happened recently was, they did a quick survey about how many, in a city, like, in a city of Calgary, they did a survey, how many people actually have general practitioners or a family doctor. And they were surprised to see the number, more than 20% didn't have one. The reason was, these primary care facilities were actually also giving, services like walk-in services, which actually took over a major chunk of, family physician propaganda. So now they've redirected that, and primary care physicians are only allowed to have a set panel for themselves. And I have worked with one of these panels, and a doctor's panel is identified by how many patients are coming in through their door and how many are actually registered with them. And once this panel is identified, what they do is we do a report on how regularly the patient has been visiting the same doctor, and how fast were the process between the doctor and the patient, and were the results or the lab tests which were supposed to come in, were they explained to the patient, and what was going wrong about why the patient were actually moving on to a different doctor, and they tried to find out the reason, and now the number has come down to close to 5% from 20 to 5. So that is a huge gain for just in one city, and they're doing this province wide in Alberta. This is what I was trying to tell you. Healthcare coverage in US. I was trying to explain that in the previous slide. Look at this: the population of 330, 3.3 million. Look at this. The numbers are in millions, right? And how many have Medicare, which are age 65 plus, less than 59? Non-institutional under 65 273, military less than 12, which is really, they should improve on these numbers. That's what I really feel. And employer based is 159, other coverage is 84, uninsured 30. Medicaid plus chip, there is another private firm which offers healthcare insurance. Then ACA Medicaid and ACA basic, non-group ACA exchange, no, other non-group. I have never seen so many different health policies which is happening in just one country. And I think it's good for business and it's good for the current country's economy, but for people who actually need the service, they are less privileged, and they don't have access to it. I think access to care should be available to everyone, and then we should decide how the person has to pay or not. Moving forward, this is how the funds has been distributed from provincial governments, from federal government and the private sector, and this is the pie diagram. And federal direct is 4%, social security funds is 1%, and social security fund in US is more. Municipal governments is only 1%, and private sector owns the bigger chunk, which is 30%. But look at the provincial and territorial governments, how they contribute towards the healthcare, which is 65%, which is fantastic. I think this is the one of the one of the changes what US has to bring in, so that they can have better care for people in place. And pros and cons of universal healthcare. I just want to touch base on this one. There are certain pros which have lower healthcare cost for an economy. Then, forces also hospitals and doctors to provide same standard of care at low cost, which is fantastic. Eliminates administrative cost by eliminating need to deal with private insurance, which is really true. Like going through a private insurance, trust me, if you try and do it yourself, it's a huge headache in itself, even after paying so much money to them. Some cons which I think people need to consider: forces healthy people to pay for others medical care. I think which is not bad. Your tax money has been actually been utilized to a proper use, and you can still see it happening in the country. You can still see people are getting healthier, and this is just smaller contribution. So, but it still comes under cons. Without financial incentive, people may not be as careful with their health, which is very true. Most universal healthcare systems report long wait times for elective procedures, and I totally agree with this. And this has been another issue in Canada, where people have to wait for a very long time to get MRI or CT scan done. And compared to that, if you look at United States, the access is really fast. But it all boils down to, if you have money, you can get access in Canada as well, and you can still pay for private companies, and you can still have this care done really faster. So it's a con, but I think it's based upon the factor which is money, right? As per the above content, universal healthcare system ranks the best in Canada and New Zealand, as everyone who is a resident and or non-resident can avail the healthcare services right off the bat, even when they are in the country. I think this is the biggest advantage, and that's why I rated them the first, because universal healthcare system doesn't differentiate between who comes from where. Are you from Medicaid? Are you from Medicare? Are you from companies insurance? No, it people's comes first. They take care of the people. Let's see how we can deal with what they are having the problem with, and then figure out about the money later, which is a good deal. But also government has to be very careful and diligent in that same process. People who are non-residents of Canada and New Zealand, they have to pay out of their pocket, but the fees are very nominal. I've seen it myself. The fees are not that very high. For a normal checkup, it's around $150, but in US, it's way more than $250 to $300. On the other hand, access to healthcare delivery system is better and streamlined in United States, where one would believe should be adopted by many other countries. I say that access is definitely good if you have money. So, there is a clause there, but still, the US is developing certain other systems, and, unfortunately, due to the current, sanitary government, which is not people friendly, I don't know where this, developmental curve is going to head, but I hope for the best. As per the presentation, there are three changes that United States healthcare system should adopt for best practices, and they are better healthcare coverage for population who neither are covered by their employer or fall under Medicare guidelines. Right? Universal healthcare system should be in place for underprivileged people in the country. Don't give it to everyone, but I would say make a system where there is a healthcare system available for the 15% of percenters who are not in the pie chart, in the pie diagram, and they should have access to care as well. Everybody should have access. This is the basic I would say fulfillment that a country should look for, should give, and should be looking forward to in giving. A generous healthcare spending account should be implemented by the government for elderly and veterans of the country, where people, if you see, only a few percentage of few millions which were 65 plus, who are actually covered under Medicare and Medicaid. What about the others who are not registered, who are not having this privilege? What do you think about that? I think there should be a huge there should be not a huge, I would say, but there should be a nice healthcare reform in place so that these aspects are covered as well. Not but last but not the least, look at the health coverage system in 12 country comparison. I've just put a small slide here just to tell you how many other countries are with universal healthcare coverage, which are funded by taxes. Look at Australia, look at Japan, look at Italy, you can look at Germany, look at Switzerland, UK, France, Brazil, right, and Canada. Everybody is under universal healthcare system, where we actually see the people are flourishing, we actually see the people are developing. Why? They're healthy, right? If they're healthy, health is wealth. But look at US, there is no universal healthcare coverage in place. There's a mix of all the other insurance companies there. Not that the other countries don't offer private insurances, yes, but they do have a universal basic health coverage in place. So I think this US needs to sit back and think about and do a good reform, and get some nuggets from other countries. With that, guys, I hope it made sense how the management system is working, and how you can actually come up with ideas, and create an impact at a level where you are, or maybe in future if you try to reach at a level where you can create an impact countrywide, that would be much appreciable. With that, signing off, this is Saurabh here again. Thank you for listening to me, and I'll be also sharing some references from where I got this material from, and thank you so much. Have a good day.